Good morning and welcome to the September 2023 board meeting of the Medicines and Healthcare Products Regulatory Agency, or MHRA. My name is Graham Cook. I'm standing in as interim co-chair of the MHRA alongside Mandy Calvert, who you'll meet shortly, and Michael Whitehouse. And my role is to lead us through the agenda today. And for those who've not attended a board meeting before, I must start reminding people that this is a board meeting in public and not a public meeting. It's also important to explain that this board is responsible for agreeing the strategic direction of the agency, maintaining high standards of corporate governance and scrutinising the performance of the MHRA. But it's also important to clarify that this board does not make regulatory decisions on any medicines or medical devices. This is because regulatory decisions on individual medical products are made by ministers in the Department of Health and Social Care on the recommendation of MHRA officials who are civil servants, with the additional independent advice of our external advisory committees, such as the Commission on Human Medicines. Now, as far as today's meeting is concerned, I also need to make you aware that we'll be recording the meeting and we'll be publishing the video on our various websites, and we'll provide the opportunity for as many people as possible to observe what the board does. On that note, I'm pleased to say that we have at least 50 people registered to observe this meeting live today, with 29 members of the public or representatives of patient groups, 9 from industry, 2 journalists and 10 members of staff. So welcome to you all and thank you for joining us. And although this isn't a public meeting, we will provide an opportunity for members of the public to ask questions about items on the agenda. And when we finished our board discussions, we'll do this picking up questions through the chat function. Please, for the people who are online, remember that the board members cannot see the comments, and that this is only to be seen by our communications and events team to identify questions and share those with the board in the public Q&A, which will come at the end. So if you want to ask a question that is not related to today's board papers, please do not use the chat function and contact the Customer Experience Centre for those instead. Please similarly do not make any personal or abusive comments in the chat, as you will not get a response and you may be removed from the meeting. We do not tolerate any form of abuse or harassment towards our staff or our board members by individual members of the public. With introductions in mind, I'd like to go around the room and ask my colleagues on the board to introduce themselves, and so we all know who they are, starting with June.
Good morning, everyone. I'm June Rain. I'm the CEO at the Medicines and Healthcare Products Regulatory Agency.
Good morning, I'm Natalie Richards. I'm the head of the Executive Office.
Good morning, I'm Mark Bailey. I'm the Chief Science and Innovation Officer at the MHRA.
Good morning, I'm Claire Harrison, Chief Digital and Technology Officer.
Good morning, my name is Mandy Calvert. I'm a non-exec director and acting as co-chair with Michael and Graham at the moment.
Good morning, I'm Glenn Wells. I'm the Chief Partnerships Officer at the MHRA.
Good morning, I'm Haider Hussain. I'm a non-executive director.
Good morning, I'm Rose Braithwaite, Chief Finance Officer.
Good morning, I'm James Pound, Deputy Director, Standards and Compliance.
Good morning, I'm Penny Carter, Deputy Director, Facilities and Estates.
Good morning, Catherine Glover, Deputy Director for Medicines Regulation and Prescribing at the Department of Health and Social Care.
Good morning, Paul Goldsmith, Non-Executive Director.
Good morning, Kerry McHyson, Deputy HR Director.
Good morning, Julian Beach, Interim Executive Director for Healthcare Quality and Access.
Good morning, Alison Cave, Chief Safety Officer.
Good morning, Michael Whitehouse, Non-Executive Director and also a co-chair.
Good morning, I'm Rachel Bosworth, Director of Communications and Engagement.
Good morning, Carly McGurry, Director of Governance.
Thank you, everyone, and thank you to James and Penny, who are joining in particular for the clinical trials paper, and we'll have one other person with us later when we talk about culture. Is there anything else that people want to raise before we start? If not, in terms of apologies, we've had apologies from Mercy Jayasingham, who is unable to join us today. She was due to present a paper. Raj Long is going to present that paper for her. Unfortunately, Raj is unwell, so she's online today. And Junaid Bajwa is unable to attend this morning because of difficulties with travel. Alison Strath, CPO in Scotland, sends apologies, as does Greg Chalmers, head of the CMO Policy Division in Scotland, and Cathy Harrison, CPO in Northern Ireland. In terms of the declarations of interest, we've got those laid out in the papers. If there's anything that is new or changed since those were published, is there anything people would like to highlight? Mandy?
Yeah, I've updated mine. There's some of those which have run their course and I'm no longer involved with.
Okay,
so
and you
that
fed
will be
those through.
updated for
Great.
the next session.
And I should add that I've joined a committee called NerveTag for the DH, which needs to be on there, and I'll give you the details of that. Yeah.
Yeah, just to say I filled out my declaration of interest as well, so that there's only one item which can be recorded in the minutes for Medicines Manufacturing Innovation Partnership.
Okay, great. Thank you. Second.
And I've been in the list, but been appointed in visiting professor at the Institute of Global Health Innovation, Imperial.
I won't comment. Great. I think if that's everything, that's great. So we've got the minutes here from our last meeting. I don't know if anyone has any comments on those. Anything people want to highlight? Otherwise, we'll accept those as a fair record. Just going through, I think the actions are picked up later, aren't they, in the board papers, so I don't think we need to go through each of those. Just check, Carly, action 99, is that coming up later? Yes, okay. So if we go through to the actions, that's fine. So action, say again? Yeah, I've got those, yeah. So in that case, we can just go to the actions from the last board. I think that we've got item 70 to develop and present a data strategy of the board. We're going to hear about that later from Alison and Claire. I won't go through all of these, but 97, ARAC undertake a deep dive on RMS. Michael, I don't know if you want to give a verbal update on that.
Yeah, I'm very grateful to HADAR because this took place on the 12th of September. And Claire and her colleagues gave a presentation that HADAR and I attended. A video has been taken of that, and so anybody can watch that online if they wish to. And I think it will help inform the discussion that we have this afternoon on RMS going forward.
So that's a publicly available video, is it?
No.
So it's internal. Okay.
It's internal.
Great. And any other comments on the RMS deep dive? If not, that's fine. 98, I think, is completed, Rose. Nothing further to say on that. 100, the board to endorse annual reports and accounts. June, do you want to update?
Yes, certainly. This was done on the 19th of July, the accounts laid in Parliament. And huge thanks to everyone who worked so tirelessly to make sure we hit that deadline. Thank you.
Great, thank you. We can close that for another year. And then 101, an update on the performance of communications and engagement. Mark, I think that's on
that should be covered by the paper
trials agenda. Great. Okay, anything else on the actions that we haven't covered? Charlie, happy? Great, thank you. So, June, it's over to you for your sort of highlights of the last month's activity. Thanks.
Well, thank you, Chair. And I think it's clear from the report that although this was the summer period, the agency was really busy. And some themes to highlight from this period, I think, include patients and the public and our commitment to involving patients and the public in all our activities. Our commitment to streamline access, including to innovative products, and obviously being an organisation where people flourish, their careers flourish in a culture of service delivery. So I won't go through in any detail at all, but I think those three themes are worth holding on to. In terms of maintaining public trust, our recently published business plan, which reflects clearly year one of the corporate plan, has as its number one pillar maintaining public trust. And I think that's through clearly involvement in all our activities, but also the fact that our ability to communicate timely information is really important. A highlight from last week was the launch of a 6th Yellow Card Centre in Northern Ireland, and that won't just provide outreach to health professionals, it will be a bridge to involving patients and the public increasingly in our reporting activities. So that was a really important step for our outreach. I think on specifics, there's a lot to read here about safety, but the consultation on codeine as a prescription medicine had a tremendous response. And as part of that, there was a user experience survey that will help us to get more out of public consultations like this in the future. And possibly turning to the devices side, mentioning how early information on the safety of breast implants has now been published in a timely way. I'd highlight no UK reports of these particular safety issues, but it's important that any woman who's considering this surgical procedure has access to the latest information. So this is all about our theme of building trust. Enabling access, I think, is a key theme as well. We're this week launching our Innovative Devices Access Pathway. It mirrors our Innovative Licensing Access Pathway, but importantly looks to speed new, innovative, potentially transformative medical devices through. And that really is an important step for the health service. It starts with a pilot. We're looking forward to expressions of interest, particularly around innovative diagnostics, software as a medical device. So let's get that expression of interest pipeline flowing. But I think what we will learn from the pilot is how to optimise this pathway alongside the work on ILAP. I think there's another contrasting side of the report, which is our recognition consultation internationally as we look to increasingly recognise the excellent work done by other regulators. So that's a really important theme when we come to streamlining access. And I'd also like to compliment the work done on the Windsor framework. We've now got labelling guidance, but we're looking forward to getting more work done on guidance for UK-wide licensing. So it's all about streamlining access. The third theme, probably the most important one, and I apologise, it doesn't come out really strongly at all from the report, but it's woven throughout, is clearly our people. And the fact that we are committed to the organisation being a place where people's careers can flourish. It can be the best part of your career here at the MHRA, has been said. So let's make sure that we truly deliver on that commitment. We've got the graduate scheme flourishing. But I want to say a particular word of thanks to everyone who's worked so tirelessly on the clinical trials issues that we're going to be talking about. Huge efforts, selfless efforts made to restore our normal service. So a huge thank you and a record from at least our executive perspective, Chair, that this was a mammoth task delivered with enormous commitment, really right across the agency. And if I have a final word, I'd say it's our staff survey launch day today. So for colleagues from within who are listening, let's get to grips with this opportunity. It will give us vital information to continue this journey, as I say, to make the agency a great place to develop your career. So 3 themes I offer up, but there's plenty more in there for colleagues to question and discuss. Thank you.
Great, thanks very much, June. And I'm sure we'll talk about clinical trials later, but I'm sure on behalf of the board, we'd like to pass on our thanks to everyone's hard work on that particular issue, but also for the hard work across the patch that we can see across all these different areas at this time. So questions or comments for June, please. Michael.
June, thank you as ever. Really interesting paper. My question relates to the Innovative Devices Access Pathway. Really support this, but it's a pilot. I suppose what I'm asking for is building on the lessons of ILAP. You're confident that when we get beyond pilot stage, we'll have a business plan underpinning this that is clear about the resource needs to make sure that this is implemented effectively and seamlessly. I know it's early days, it's a pilot, but I think it's really important that we look, that we look ahead and that we can ensure that what we say we then deliver effectively.
Well, this is really important, and this is the right time to ask these questions. When the intention to have a pilot was first launched, there was an amazing level of interest, and I remember a figure like 50 calls very quickly, and we know that the medtech arena is absolutely vibrant, which is why our colleague Dr. Laura Squire is spearheading the regulatory reforms that are needed. But the specifics of your question go to how to operationalise this efficiently. And the number one, as with ILAP, is scope. We're looking to really focus down on a small number of truly transformative products so that we can then resource accordingly It's not just how many full-time equivalents, it'll be the kind of expertise we need to pull these products through to healthcare. So I think in a nutshell, the things that the pilot will test will be what's a reasonable scope, what is the governance, and you'll note that the announcement, when you see it later today, will include not just regulator, but all HTA bodies across the UK, which is fantastic, and the NHS all saying we're working together. So governance, and then clearly the third pillar is exactly what you've said, which is resource. So scope, governance and resource. The pilot will run, I think, for a few months, and by that time we will deliver, I think, what is quite a breakthrough pathway.
Thank you. Mark, do you want to add to that?
First of all, excellent question, Michael. We're delivering this under a grant from the DHSC, and we are immensely grateful for that support from DHSC for such an important activity. The pilot is the first half. The sustainability plan is covered under that grant as the second half. During the setup of the pilot, we, as Juna said, have spoken with the stakeholders, including the approved bodies who actually support devices, so that there's going to be considerable work in bringing together a really large consortium to meet the ecosystem and hit that sustainability. And I'll expect us to report back to the board on that, as that work will be ongoing over the next 18 months.
Great. Mandy.
Thanks, Graham. My question was about the regulatory management system, and really encouraged to see we've got the first release in March 2024. Could you just say what will be in that release and how we've incorporated the lessons learned from the work we've been doing on clinical trials and established products?
Well, maybe if I kick off, and then as you've turned to your right, I know Claire, our Chief Digital Technology Officer, want to come in. Clearly the deliverables are front and centre, and what the executive are really looking forward to is the new portal. Obviously, the front door to any organisation has got to be the best it can be. So of the range of deliverables by March, the new portal for industry particularly, and all our stakeholders, is going to be a key deliverable. But Chair, I think probably to animate the question a bit more, we need Claire's comments.
Thanks, June. Yeah, the first public-facing release is March 24, but there are releases coming before that are more for internal users, but that promote lots of efficiencies, whether it's around validation and so on and so on. So that then has benefits for external customers as well. So quite a few different cycles of releases that make up release 1. And a couple of drops then culminating in the portal, which is the external facing component in March 24, and then continuous improvements and release cycles and drops then for subsequent years as well.
So can you comment on what people might notice before the end of the year externally? What will they see that's different?
So by March 24 then, with the portal, that's the first thing. It's the front door to MHRA and to the regulatory management system. So the way that applications are submitted and then the processing that goes along with that, and being able to track an application and have more information around its status, and just encompassing the principles of self-service. So rather than having to reach out, email, telephone or whatever to chase something up, customers have that ability then and that functionality. So again, promoting lots of efficiencies and a better customer experience, and all the time after that building upon that portal, so adding more and more and more functionality. But we were keen to, we follow a principle of MVP, so minimum viable product. So put something out there, the minimum that we can put out there that is still really viable / valuable to customers as well. So that's the balance in the portal that will be delivered in March 24.
Okay, now that's encouraging, because I think it's submission and tracking is key for our customer base. And can you just confirm that you've incorporated the lessons learned from the work on clinical trials?
Yeah, so I can confirm that, and again, it's not something that we look at once and then leave alone. It's continuous engagement with relevant stakeholders and users, colleagues and so on, and acting upon that and baking it into everything that we design and deliver.
Okay. Any other questions? Paul.
So I was sort of interested with the Yellow Card Satellite Centre, because I didn't realise we had satellite centres, and I think we're sort of really keen for more and improved patient engagement and learning. So broadly, this seems a good thing, but I was sort of thinking in the overall context of other activities, how much does this sort of cost, and what does it deliver versus the other efforts that we're putting in?
Perhaps I can kick off. This has really evolved over the years, given the enthusiasm we have for the outreach that is the, if you like, the fundamental cornerstone of reporting. And the amount that we put in, and I don't think it's right at this moment to quote figures, is about half a full-time equivalent for each centre to enable us to actually deliver the kind of outreach that we want to. And it really is important that we see this, as you say, as value added and can measure it. There are various strengths of the different centres. Not only do we have Wales, Scotland, Northern Ireland now, but we have the English centres that actually all develop their own areas of special interest and expertise. So I would say, if I can't give a figure for VFM, that it is more than, if you like, the investment that we've made traditionally over the years. I think it will deliver even more, before I turn to you to ask Alison, when we come to looking at some of our special projects, such as the biobank. But perhaps Alison can give the chair, through you, the up-to-date.
Yes, it was a real pleasure to launch the centre in Northern Ireland. Obviously a key part to have a centre in each of our devolved nations, so incredibly important. And they are incredibly important for us in terms of really encouraging reporting regionally, because they understand the local practices and what may work better in those areas versus the whole country. They liaise with patients. The Northern Ireland Centre is now launching a roadshow around each of the regions, so really looking into each of those different regional parts of Northern Ireland and how that will best promote reporting. Lots of good ideas. We had a long meeting with them prior to the launch about where we could liaise better and facilitate reporting and help them. So it is incredibly important, and they are a massively critical network.
You have to say I wasn't aware of them before either. So they have a public-facing and a sort of stakeholder-facing role.
Yeah.
In those. Cool.
Yeah.
Yeah, that's really encouraging, and I can see the value of that local network. And
yes,
if they're not already, then linking up with the AHSNs might be something to consider.
The academic health science networks, for those who are less familiar.
Yeah, very good.
Yep.
I could add that they run local conferences. They link in with them, the medical safety officer, the medical device safety officer network in the local regions as well, which is very helpful in terms of sometimes there's local factors which affect safety, which they're best placed to manage and help us with. So they work with academia as well in their local areas, e-learning portals, they've all got websites, and they work with local charities as well. So an incredibly helpful resource.
Great, thank you. Hayden.
Thanks, Graham. June, really fascinating report as always. I was especially interested to see the work around limiting access to opioids, and also the work of the Criminal Enforcement Unit, and especially the partnership with the leading online service provider. I was just wondering if you could expand on that at all, and is that something that we'll see more of in the future?
I very much hope so. And I think it fits with the conversation we've just had about effectively having partnerships who've got outreach that we, if you like, don't inherently have in-house. I don't know if Claire would like to pick up some more detailed comments in response to Hayda's point, though. I've just given a very high-level update.
Claire? Or anyone?
Yeah, what were the specifics
I remember talking to the criminal enforcement unit and being really impressed with their work, and they're quite a small unit. And I remember in a previous board we talked about partnerships with large IT companies that had the reach, and I was wondering if this was the beginning of that.
There are quite a few things actually. So there's a separate project just with the enforcement team anyway, as well as other projects that touch upon that area. So we're looking at partnerships with some of the organisations that you've talked about, but also looking at what other countries do across the globe as well, and learning lessons, sharing experiences from there. And from that, it helps to provide a steer about what kind of technologies and approaches that we want to use. So it could be anything from the way that incidents or things that are dealt with in that team are processed. So technology is just being more slicker and using data and automation, but then also looking at things outside of the team, so websites and the kind of scraping that we can do there for intel and using that data. So lots of different aspects and with lots of different collaboration partners. Sometimes I think it's less about formal collaborations, but a lot more around that lessons learned in that kind of ecosystem and sharing those experiences. And then with industry, tech industry, putting all that to work as well.
Alison, did you want to?
Yeah, so this represents ongoing action really from the Criminal Enforcement Unit to try and manage what is a growing practice. Obviously it's very challenging, as the people around the board know, about managing illegally trading websites, and this is just another another attempt, another activity to try and manage that with a partnership externally.
Thank you. Can I just ask one thing, June, probably Alison, about the CPRD? I was pleased to see that we've talked before about the benefit potentially of a scientific advisory group. So can you just talk a bit about how that's going to be shaped and really what that brief is going to be for that?
I think probably Alison is best placed to say where we're at now, but taking on board your point, the potential to use our kind of unique asset of real-world data, and not just for external use, but internal use, is really, one feels, an imperative now. Now that we're looking at earlier access, now that we're looking at the ways to connect data sets and becoming a trusted research environment, optimising the use of CPRD while protecting confidentiality, etc. We really need that scientific, if you like, drive. But I know Alison knows the latest.
Yeah, so as everyone aware, the clinical practice research data link is a really critical part of our activities in trying to understand the performance of medical products in clinical practice, in the real world is what we often term it. And this is really a new advisory body that we've set up to try and understand the place of CPRD both nationally and internationally. The health data ecosystem is incredibly complex, and there's lots of new initiatives both with NHS England and the devolved nations, but also externally and internationally rather. And what we want to make sure is that CPRD is best placed with all of its activities, be it observational research, be it interventional research, as well as monitoring products on the market to allow it to flourish in what is a very competitive atmosphere. So we're bringing together healthcare professionals, the devolved nation representatives, the health ecosystem, HDR UK and other colleagues, but also international colleagues and tech companies to try and understand how we can further promote the growth of CPRD.
Great. So that's established now, that group, is it?
The first meeting will be in November, and we're imagining it will be a sort of a biannual meeting.
Okay, great. Time for one more if there is any, otherwise we'll move on. Maybe not. Okay, lovely, June. Thank you very much. That was, as always, a really broad and exciting agenda we've got there. And it was also useful to see some of the operational stuff in there as well, I think, as a routine matter. I think that's useful. Great. So next, I think we move on to the report on operational performance, if I've got that right. Yes, with Rose. Thanks. So Rose, I think everybody's had the paper and read it, but I think maybe some things you want to highlight. There's quite a lot of slides. So I guess what we'll do is we'll probably go through each section in turn in due course. But if you want to start with a sort of summary of what you think is most important.
Thanks, Graham. So this paper outlines the first quarter performance, so takes us to the end of June. As you're aware, we were developing our business plan at the same time. So you have the business plan performance where we are showing the delivery plan for the rest of the year, because we were still writing it in the first quarter. And we also, in the paper, we are talking about how we can improve our reporting, our performance reporting. And I think that's quite critical going forwards, so that we have a better view of early warning systems about backlogs and early indicators, so that we can provide more assurance to the board about how the organisation is performing. But happy to take any questions or share them with the other chiefs on particular performance areas.
Thank you. Yeah, we'll go through. So any general questions initially for Rose on the paper? Mandy.
Thanks, Graham. Recruitment seems to come up as, and people and resources comes up as a sort of common thread through many areas. Can you give us a view on the level of that risk, and then what we're doing to differently to mitigate that risk? Because we've had it for a year or two and we seem to be making some progress, but it seems something just knocks us off very easily. And then I just notice it's the main risk factor in many of the objectives we have going forward. So just to understand the plan we have to mitigate that risk.
So we are in a much better position than we were last year, because we are pretty much recruited up to our full complement. We do recognise there's around normally an 11% vacancy rate, which is within tolerance for an organisation such as ourselves. The issue is that we do have very specialist staff, and it's around ensuring that we recruit those specialist staff in a timely manner. I think we have proved in the last year that is in a better place, and it's this particular year has been around moving staff to where they are needed, so particularly moving staff to clinical trials to ensure that we get back on board on clinical trials, which has meant that there are shortages in other areas. But we are resourced up to what we'd expect to be at this current time.
Kerry, do you want to add anything to that?
Yeah, I think it's important to look at the context of recruitment across the UK following the pandemic, etc., etc. So there is it's a candidate-driven market. It's very fierce, and candidates have lots of opportunities. So what some of the things we're looking to do is to look with the government people group at how we can make access to civil service jobs, our jobs, more streamlined and competitive with other sectors, because it is slightly laborious, if I'm honest. So they are looking at that. We're part of that programme because we want it to be as quick as click apply, which some sectors can do, and we can't compete with that unless we change the government model of recruitment. So we are doing work on that, and so hopefully we'll be able to report some improvements in speed.
Okay, I think that's encouraging in terms of access to the biggest civil servant pool, making it easier, and hopefully there's some lessons learned from how we've brought staff in to help with the clinical trials piece, that those people are also enthused to come and join the agency as well on a short or long-term basis.
Michael.
Can I build on Mandy's point? So I, in my executive career, worked close to the government, and in the past I remember the period when the coalition government came in, and there was a lot of emphasis in the Cabinet Office of recruiting digital people into government. There was a recognition, I thought, by the Minister at the Cabinet Office at the time that you would only do this if you differentiated pay, and basically you're never going to compete with the private sector, but digital people were paid more to bring them into the... And I wondered, is there that recognition, I'm sorry to put you on the spot here, but is there that recognition across government and in the Cabinet Office in particular, that if you really want people with a scientific background to come into this work, you are probably going to have to pay more. You're probably going to have to think differently about civil service career. And actually, I'm not sure the brand civil servant necessarily attracts people if you're looking for, and I just wondered how seriously this is now being taken by central government, particularly given that we hear all the time about the commitment to life sciences and how that is going to promote economic growth within the United Kingdom.
Very good question, Michael. I would say very seriously.
Okay.
The government people group are about resourcing the civil service to the best of its ability to serve the public. And so there is a lot of work about recognising competition with other sectors, but there's also the brand civil service and whether people like we recruit or need to recruit actually see that they have a career in the civil service at all, or there is the availability of careers in the civil service. So there's a massive piece of work going on to do that. And in respect of pay, definitely, Cabinet Office has frameworks for digital pay, but it's also looking at other elements so that we're competitive, particularly, say, with the NHS.
Now, that's one fun. And are you confident that we are taking maximum advantage of the latitude that gives us in terms of salary and...
I will confess to being naturally confident or optimistic.
Yeah, sure.
With that edge, yes, I am, yes.
Thank you.
Claire, did you want to follow up?
Yeah, I think it's recruitment and retention and pushing the boundaries as much as possible. So, for example, internal apprenticeships. So not just external, say, school leaving age, but what we can do internally if people want to change career paths and so on. And that's happened in my area, so supporting that. I think just something around what we call the employee value proposition. So obviously there's a sort of financial package, but probably talking more about what the agency does, what we're good at, what it means to work in, say, digital and technology, and just getting out there a bit more at job fairs and so on, and not the usual just civil service kind of avenues as well. And again, probably I think we can be a bit more flexible around maybe perhaps leveraging home working contracts and that kind of thing, and more hybrid. And I've mentioned locations and often being a constraint as well. So there's always those things that we can tweak that might make a difference.
Jim.
In terms of specialists, and our recent experience with clinical trials really has highlighted that. We've got a couple of initiatives running, and I think the board would like to know a bit more when they take a bit more shape. One is with fellow arm's length bodies. The UK Health Security Agency are also civil servants, and NICE is very close to us in terms of evaluating the kind of scientific data packages, and as we start to share data more, we'll be aligning the kind of expertise we need. So those arm's length bodies, NICE and UK HSA, are working closely with us as we start to look at the ways to build career pathways. And it's something previous Chair Stephen Lightfoot was keen on and has been working up with NICE. So I hope that will start to take shape quite soon and have some practical impact. The second one is through the Faculty of Pharmaceutical Medicine of the Royal College of Physicians. And I'm glad to say, particularly under leadership from Glenn, that's beginning to look at ways in which, as they have a strong educational pathway and role, that we can link with that in a way that doesn't raise concerns about conflict of interest. So those two, I think, will help with the very real concerns about specialist attraction, because I think the content of the job is fantastic. It's just making sure that people see it is part of a career pathway, not a side alley.
Glenn, I don't know if you want to follow up.
Just a couple of things. I think just to want to make the point that we often talk about the civil service and then talk about what the brand is and what does it offer. I think being a civil servant is core to a lot of my colleagues, and they are proud of that. So we shouldn't just think of the specialties we need to attract. We also need to keep our career civil servants in the civil service that they hold quite close to them, and I'll put myself in that bracket. I'm very, very pleased and proud to say I'm a civil servant. So that was my first point. On the faculty question, we have been working with their board, thanks to June, we have contact there, and they've established a task and finish group for us to bring in secondees, fellows and other short-term support when we need it. At the moment, focused on clinical trials, but we'll broaden that out over time and bring in a much bigger scheme. So we have their buy-in at the very highest level.
Hayder, do you want to come in on that or something else?
It was something else.
Please, yeah, go on.
Just going back to CPRD, if I may, I'm really pleased to hear about the scientific advisory group and the linkages we're making with other bodies. I was a bit confused with the graph that's on page 57, because I think when it talks about a 9% income growth, it's comparing it to 21-22, not 22-23.
Is this the one we're looking at, page 29, I think? I'm not sure what numbering you've got. Slide 29.
Slide 29, sorry, page 57.
Yeah.
Yeah, and then slide 33, it talks about the underperformance in CPRD forecast for this year. So I was just wondering if we had a feel for the income growth this year, whether there actually would be income growth, or whether that forecast suggests that actually income has turned out.
Alison, do you want to?
Yeah, so I could comment a bit on it. So we've had some legal issues just when we've been redesigning some of our services to make sure that we've got the contracting right, but those have just been agreed so that we can move forward with seeing revenue in some new areas, which is really good news. We've had some revised multi-site licenses, also the terms of those been agreed by legal, and so we can now recognise income that was back to April. So that will catch up a bit. We have still challenges in the interventional research platform arm, and that is the one that is probably struggling the most, and that's partly the ecosystem, but also partly the platform that it works on is a bit clunky and a bit challenging to use. So we've got sort of two initiatives there. Obviously, we are in the process of upgrading and amending that platform. So I think that those initiatives will come through and start to really have an impact shortly. But that revenue remains under what was forecasted at the moment. So that is a bit of a challenge. But we're looking to manage those and phase recruitment and so that we will come in, as we hope, more or less on budget, but of course it's a movable picture at the moment. But reasonably confident that that CPRD will be on budget, might be slightly under, but we just need to see how all of these different initiatives pan out and the impact that they have over the next 6 months.
And then next year we would
Hayder, can you just...
And then next year we would expect a healthy increase again.
I think it's a challenging ecosystem, so I think to expect a healthy increase year on year, I'd have to talk to the team and see what their predictions would be in that space.
I mean, maybe so we've got a lot here, Rose. I mean, I think maybe what we'll do is we'll just go through, and I guess people might want to dive into one or two bits of it. So if we start with the performance indicators, I don't know if there's any particular, Paul.
Yeah, on the HQA performance, I mean, actually, the large error bars I quite like, because that shows that we're not just sort of doing everything to the final sort of deadline day, but the overall trend is upwards, so it seems to be going in the wrong direction. And I'm assuming that sort of clinical trial work sort of knock-on effect. So it's a question on that, and but particularly, what do you think we should be aiming for in terms of turnaround times, both for National and Reliance? Reliance looks quite quick, but that's just because National is so slow. And is 200 days, which I presume is working days rather than calendar days, is that too long?
Julian, I don't know if you want to come in, or Rose.
Yeah, no, I'm happy to answer that one. So really looking at it, the trend is going in an increasingly positive direction. We are working through the backlog of applications, which does give you the increased error bars. So that is where that is not a realistic estimation and trendable going forward as we clear the backlog, so that we are actively targeting and moving things forward. So as you will see as we go forward into the next months, and you can see on the published data on the website from the last data that was published on Friday, the 15th of September, you will see that trend is continuing to be increasingly positive. And a mid-month update for September, we are increasing that still further. So we do have a very positive trend despite having transferred some staff to clinical trials. We do have elements which have been impacted by that, but we are looking at how we can minimise that impact as far as we go forward, and to see how that will then translate into ongoing performance within the HQA licensing framework. Regarding expected timelines, obviously our commitment is to meet statutory timelines of 210 days, ECDRP timelines of 67 days, and reliance timelines as appropriate, so that that is our ultimate aim, that we will be delivering to those statutory timelines, and that's what we are targeting within the plans that we have.
Do you think we can be we can go shorter than those? So rather than go right up to the sort of the deadline day, that it can go shorter. And partly it's a related question. I was interested that the specials route seems to be on, and you say describing an upward trend. What are the reasons behind that, and is that linked to companies sort of having slowness of getting new products through?
Yeah, I mean, I'm happy to continue. So I think there are a few different things which are going on here, so that there are some prescribing trends, particularly for the supply of some of the specials or unlicensed medicines that we have, which are an ongoing concern in terms of ensuring that the medicines that are reaching patients for ongoing supply, which we have incident management teams within the MHRA working closely with industry to manage. So those particularly are unrelated to any operational delivery criteria from the MHRA, more around the other aspects of what we need to be delivering. So it's quite a complicated framework in terms of it, but there are some discrete sections to how we can do. To your question around can we do it quicker, my response is more that I am following some pretty extensive communication with industry. I'm not being asked to do it quicker. What the main ask for me to do is to do it to be reliable and be predictable and to be transparent. And that is my overriding aim. And then once we can do those kind of three, they're not buzzwords, they are real requirements that we then are able to then look at how do we do things maybe in a more, what does this future structure or other aspects, what does that look like? But we need to be delivering the basics reliably and on time to a defined timetable. And that's really what we are really working to right now.
And so with that in mind, can I pick up your comment on transparency? And I think in the paper you talked a bit about the need to define a bit more of the metrics, but you haven't defined them. So can you just say when we might see those and how close you are to finalising those?
So to be honest, we're starting work on them, Graham. We have an additional member of staff coming in to support this area of work. And we're obviously taking lessons learnt from clinical trials where the information is a lot better now. So we anticipate that we will be able to bring you a first view of it at the end of Q3. So we'll have one more like this at half year, which we're approaching now at the end of September. And then by Q3, we shall have a draft version of the new metrics to bring to the board.
And at the moment, the data going out on clinical trials will be going out monthly still, as it has been. Is that the plan? Mark, did you want to comment on that?
I anticipate that will be going out monthly, yes.
Chair, if I may, there are two drivers on the metrics of clinical trials. First of all, the internal metrics for our own performance, and through the work we've done on clinical trials, which we'll come to in the next paper, we've revised the metrics. There's also the work the government is doing on the O'Shaughnessy report, which will be announced in full in November, or we expect in November. The monthly figures we put on the website will include part of the response to the O'Shaughnessy report. Those metrics will need to be revised as the government's response becomes clearer. So we will continue the monthly report, but I do expect some of the details to change as we go on.
So that might split out commercial, non-commercial.
That's been one of the requests that's been made, yes.
Okay, yeah.
And just to add for the licensing side, we are increasingly, as we are getting the metrics available for publication, we are including more metrics on a monthly basis. So in the ones that were published on Friday the 15th, you will also see the impact of the Type 1B commitment that we made from the agency, which we are meeting.
Yeah.
So there are 93% that were approved on time in August, and the others which were not, there are specific reasons why they were not, which we are able to track, so that is ongoing as well.
Okay. Yeah, I saw that in June's report as well. Thank you. Just in the interest of time, and unless there's anything more on that, we'll come to the trials in a minute. If we go through each section briefly, any questions on patient, public partners and customers, slide 13 onwards? Michael.
Could I ask a question? I don't know if this is the right place. I'm a bit concerned to see that in Q1, number of parliamentary questions received increased to 66. That's, you know...
Can you just point us where you are there?
This is on page 15. So the average seemed to be that we normally get around about 20, 22. So 66, that starts suggesting to me that people are contacting their MPs because they're concerned about something. And then if you relate that section more widely, when we're talking here about the reputational index that's been developed, and then I hear what Jonathan says, that the industry is saying what they want is reliability and certainty. I'm trying to bring a number of things here together. I'd just like the agency's view on, are we going to actually keep a track now, a better track on what industry thinks of us? Now, I really get that our primary client is patients and that the trust that they have in us. But if we're going to increase access, if we're going to have innovation, we need to carry industry with us. And industry's views don't feature that much in this whole section about patients, partners and customers. And I just wonder, June, going forward, are we going to capture that much more early so that we avoid something like clinical trials happening again?
It's a good point. I think where we've begun is with patients and the public, and our Public Health Committee regularly tracks all the information we receive, if you like, as signals through our Customer Experience Centre and other routes. And you've mentioned parliamentary questions, etc. So we've developed that as a resource. Where we've focused for industry is primarily through the close links we have with trades associations. But that isn't the whole story. And I would like, building on what you're saying, to see something much more bespoke and much more real time. Because I think when we look at the next paper, it took a lot of issues being raised at very senior level in government for the issues around performance to be properly identified. So we need to work much harder to make sure we have that real-time perspective on our customer experience from the industry.
And just picking up the question about parliamentary questions, I don't know if anybody's able to comment on that particular change.
I don't have a breakdown of what they're on, but there are live issues, the current issues that pique interest in Parliament. We get questions on those, so I'm not surprised there was a big increase. What I can do is take away an action to give the board a breakdown of what they were.
That'd be helpful. If there's a lesson for us to learn there, that'd be useful to know. Great. So just continuing through this, and I think SRI, Science, Research and Innovation, I don't know if people have...
Graham, just...
Sorry.
Yeah, just going back to that slide. The complaints that we've received from the Customer Experience Centre, I think this is just a measure of those that come through the CEC, not all complaints across the agency. And I'm just trying to understand if that's representative, both in trend or of the big issues, and how we can capture that customer feedback, good and bad, in a bit more of its entirety.
Rachel, do you want to comment on that?
Yeah, thank you. Certainly something we're working on. So just a few days ago, we took a paper to the Audit and Risk Assurance Committee on complaint handling, which showed the complaint figures that the Customer Experience Centre had handled, and also for the South Mims site, and that included a commitment on the work we're doing to extend a single complaint management system across the agency, so we can be more confident that complaints are being captured, dealt with, and lessons learnt from them wherever they come into the agency.
that so far the focus has been very much on customer experience centre, but now I think as we've got that part of the system working well, over the coming months we will then extend it. But Michael, you may want to comment on
before Michael comes in. Maybe I don't know if I don't want to put you on the spot, but in terms of that question, do you have a sense of what proportion of the complaints are coming through the customer centre?
Not off the top of my head, because as we're not capturing them right across the agency yet, it's quite hard to know what you're not capturing. I feel much more confident that we are capturing all the ones that come into the customer experience centre, assessing them by level, and what action needs to be taken as a result. And as I say, that we've started work with the South Mims site quality management system to capture their complaints as well, as currently they're recorded separately, and now it's spreading it to other areas, so we have a single consistent view.
Okay, yeah.
So it's very much work in progress, but we can provide some more detailed numbers afterwards if that would be helpful.
Well, it sounds like that might be a bit of Michael, do you want?
Yeah, I've got nothing to add. We took the paper at ARAC last week. It was a good paper. One of the issues that we saw assurance on was that the agency was really proactive in responding to customer complaints and understanding them as not being a hindrance, but as a real important information asset which we could build on to continue to improve, and we got that assurance. So I'm encouraged, by Rachel, by what I heard.
Great, that sounds positive. Anything else before we move on? There's quite a lot of other things. So SRI, are we okay to move on to SRI, Mandy? Are you? So SRI, I don't know if there's any comments on there. HQA we've touched on already. I don't know if there's anything else people would like to highlight. Parallel implementations, and then safety and surveillance, I don't think. All right, I'll just go through. CPRD we've touched on. People we'll come back to in finance. Okay, well, I think in the interest of time, in that case, we'll just move on. But thank you for that, Rose, and that's a comprehensive set of data for us to work through. It would be useful to hear soon what your thoughts are on those specific metrics. I think particularly the ones that we can share publicly and regularly, that people will appreciate, going to that point that was made about predictability. Thank you. Okay, so the next paper is on clinical trials, and we're grateful for James and Penny joining us for this one in particular. Mark, I don't know if you or James want to introduce the paper.
I'll just say a few words. So the clinical trial situation we've mentioned already in this board. It's been a very serious situation, and I'm very pleased to support what June said. There's been significant effort by staff, and we're very pleased to announce that we're clearing the backlog, but it is a step on a pathway to actually solving this situation. So we're working both internally to improve our own processes and also to keep them aligned both with the government strategy on clinical trials and also international comparability of clinical trial results. So it's quite a complicated area we're working in a dedicated way. I'll now hand over to James, who has been running the crisis response, and later we'll hear from Penny, who's been working on lessons learned. Thank you, Chair.
Thanks, James.
Thank you very much, and good morning, everybody. Just at the outset, it's worthwhile setting out that this paper is very much addressing the extremely important issue of the agency's performance on the assessment of clinical trials. That's both a core function of the agency, but also something that's a vital enabler to the UK life sciences and the benefits that that brings to patients in the wider healthcare system. So this is an incredibly important issue. What the paper sets out is the agency's very urgent action to address where there were delays being experienced in assessment. It sets out the action we've taken, it sets out what we propose to keep in place to maintain performance, and also sets out how we will take this work forward in the future, not only to maintain performance, to improve in the longer term. In section 3, we talk around the 3 key levers that we implemented as part of our urgent response in mid-July. And that was around redeploying resources to support the assessment across the 3 disciplines of clinical, non-clinical and pharmaceutical assessment, improving our processes with patient safety paramount, but also ensuring that the agency has a risk proportionate approach to the assessment of clinical trials, and also the use of external resource, both those of contractors as well as forming a unique collaborative partnership with the NHRA, the National Institute of Health and Care Research, to to access their very wide range of clinical experts to support the assessment process by the agency. In terms of where we are with performance, the backlog that existed in mid-July of approximately 966 clinical trial applications delayed has been cleared. None of those are awaiting assessment. And all new applications are being very closely tracked as of the 1st of September to ensure they're compliant with the statutory timelines for both initial and amendment applications, which are 30 and 35 days respectively. In terms of maintaining performance, there will be a residual redeployment of staff to ensure maintained performance. That will be a relatively small number. We will maintain the very precise and clear oversight and management of the performance of that team to make sure it is maintained. And we will continue to make use of some of those external resources to ensure that stabilised performance is maintained. Going forward, we have a number of proposals which are aligned with the UK government response to the consultation on future clinical trial regulation, as well as the Lord O'Shaughnessy review. First and foremost of which is a pilot on the use of a notification scheme for low-risk trials to enable them to proceed through the assessment and approval process in an expedited timeframe, and the benefits that brings to those in the research community. In addition to this, we'll be looking at what are the short, medium and long-term investments in our infrastructure. We discussed RMS earlier and the importance of transparency to our stakeholders of the progress of their trials, enabling them to ensure their business planning is optimised. And we'll also be looking at the resources required in that team longer term, making use of some of the funding the agency has as a result of the Chancellor's investment in the agency earlier this year, and examining the structure of the team to ensure it's optimised to perform in the way that we need it to going forward. We'll also be continuing that long-term relationship with MHRA to access that very wide range of clinical experts to support our assessment in the longer term. In terms of impact on other parts of the agency, impact assessments were undertaken at the very outset of this initiative back in mid-July, and that ensured that we prioritised a range of key areas for the agency's business and corporate and delivery plan, as well as for patient safety. We've certainly maintained those core activities, and where there have been impacts on some other parts of the agency's activities, which we picked up earlier in the discussion, we are taking action to mitigate and minimise those impacts rapidly. And we are also strategically coordinating the phased return of some of those redeployed staff to address some of those issues. In terms of communication, the agency has taken a more proactive approach as we've entered the proactive response that we initiated in July. This involved making sure that we're contacting all of the different stakeholders who were in the backlog at that point, providing more effective messaging to our partners in the healthcare system and engaging with the trade associations to give them updates on our progress. And going forward, there is a forward-looking communication plan that will be looking to reassure stakeholders, both in the UK and internationally, of the performance of the agency and how that plays a role in the wider attractiveness of the UK life sciences ecosystem for clinical trials to be undertaken. The paper concludes with 3 questions to the board around the approach for maintaining sustainability for the assessment of clinical trials, the approach around the longer-term work to improve clinical trials performance, and on our communications approach and strategy. Thank you.
Right, thank you, James. A very helpful summary. I think maybe, Penny, if you want to come in first, just to talk a little bit about the work you've been doing on lessons learned, and then we'll open it up for questions.
Thank you. So I was asked to look at the lessons we could learn, and as James and colleagues have already highlighted, there's been a number of key themes that have come through. And we really identified 3 areas we need to look at right across the agency. One is how we can have early warning of potential backlogs that could be sitting in other parts of the agency. And work is already progressing to look through marrying these with our statutory requirements, working out how we can use the new digital systems that D&T colleagues are bringing in, making sure we've got clear processes to be able to extract the data, mine the data, and have a process for highlighting it to various committees, our chief officers, and up to EXCO. So we can quickly identify when there is an issue that we need to mobilise on. We also recognise that we were perhaps too reactive in our communication, and so we need to be really clear how we can have a more proactive approach with our customers and our stakeholders to make sure that we're maximising our consistent communication using various channels so there is ready data available for people so they feel informed. We're transparent about the issues that we will have as we go forward. It's a fact. I think the other lesson that we've learned is we need to have flexible, agile staff, and we need to really make sure that when we do lose key staff, we are quick to move forward with recruitment, and we also have robust training mechanisms in place to bring them up to speed so we can train them. All this work has already started, so it's already in train. I think we're coming out of a very difficult time, but actually if we really engage with these lessons from an agency point of view, which we've already got, and move them forward, it will help us learn and be smarter. I'll pause there. Thank you.
That's a good moment to pause. I think that's an important message. Questions or comments? Don't be shy. Claire.
Just a quick one from me, and it's linking back to one of the issues that we covered earlier in this meeting around recruitment and difficulties, and that coming up all the time at board and internal meetings. So just if you have more specifics around that, the sort of tangibles that have come up as part of the lessons learned, and how we're linking that to the earlier discussion. I don't know if that's for you, Penny, or Mark, or someone else.
I think what I have picked up from the lessons learned is that, it was hard to find the right staff to hit the ground running. And I think the lesson that we've learned is that we may need to recognise that we may need to recruit and train staff, and therefore we need to have robust training processes in place. And I think that's the lesson I've picked up from lessons learned, but colleagues may have other points they wish to make.
But if I understand what you were saying, then is there an effort to try and do more training for people in areas they wouldn't normally be working in, so you've got more resilience in the system, or is that going to be too complicated?
I was going to say, just to build on that point, I think one of the tremendous assets the agency has is its staff, and I think their performance through this response has been outstanding. They've demonstrated the flexibility and willingness to very rapidly upskill and support other parts of the agency, and I think that's a key lesson for us to learn. It's not just a one-way journey to support clinical trials, but there will undoubtedly be opportunities for them to support the work in other areas of the agency. I think that's something we should capitalise on and build on as part of our future training programme, because it ultimately gives us a much more experienced and flexible cadre of staff to respond to what are going to be evolving requirements, continually. So I think that's something we're building out from that. I think in terms of recruiting and training new staff, I think we've already touched on that there are challenges in the sector we're in because of the competitive nature in the UK, especially of recruiting those staff. So how we use things like the initiative with the Faculty of Pharmaceutical Medicine, but how we train, develop and grow our own staff to provide that longer term pipeline of sustainable staff. So whether that's through the use of apprenticeships, the agency recently launched its new graduate scheme, which again provides that pipeline of future talent that means we can be in a position to have a much more stable inflow of new resource, as we obviously see folks go on to careers outside of the agency after the successful time they would have had with MHRA.
So where does that role in changing that training system sit? Is that something you want to comment on, Kerry, or someone else? I'm not sure. Is that easy? I mean, it strikes me as something that's important but difficult to do.
It is important and difficult to do. So there are two aspects to it. Within the clinical trials, we've had to look very closely at the technical aspect. We have specialists in medical appraisal, pharmaceutical appraisal, and what we call non-clinical, often toxicology. We've also discovered during this that we had significant work to do around the regulations. And so we've effectively been creating new tasks and new roles around regulatory science to support this. So all of those technical work, we've revised the training put in place. And then we've got to mesh it with the point that Kerry was making earlier on about the civil service recruitment, keeping in line with the civil service principles of doing that, and just trying to basically improve the efficiency of the recruitment process as much as possible.
Sorry, yeah.
Yeah, I mean, just to add on that, I think it's only one element of the of moving it forward. So I think having a rotation of staff between different areas provides a bit of resilience. But I think it's also looking at how do we have a future cast of demand. So where do we see things are going? So what are likely to be trials? What are likely to be license applications? What are likely to be new, novel indications or therapy areas that we need to be resourcing, so that we can have that as an ongoing aspect.
So can I pick up on that then? So in terms of the trials in itself, at this point, do we have a clearer idea of what we think the right size of workforce, the right type of workforce is to keep that sustainable?
Within the trials, I'll defer.
James, you want?
Yeah, I can certainly add. So I think one thing that's important is to have an evidence and data-driven approach to understanding our resourcing requirements. So one of the other elements that has come through our response is we've very clearly been able to determine what level of resource we need to make sure that's sustainable, and that's a component of the recruitment that's now happening in that part of the agency. And I think just to the point around how do we manage that piece around the kind of rotation of staff, I think we have our people strategy, we have the training plans and programs across the different groups. I think that's just the coordination amongst the three frontline assessment type groups of HQA, SRI and SNS to make sure we give staff those opportunities. But very much we know what we need in terms of future numbers for the different technical disciplines as well as support staff. And we'll be very much moving at pace with Mark and Andrea, who's the Deputy Director, Andrea Manfred, Deputy Director for Clinical Trials and Investigations, to recruit those additional staff.
Do you want to come in?
Yeah, and I think it's also playing on Penny's first point about getting a future view, not just early warning of backlogs, but to understand what's going to come through the industry and the life sciences sector. So I think understanding what intelligence we've got in the types of clinical trials there are on company slates and on academic institution slates to understand what's coming through, and through trade associations, so that we've got some time to upskill or get people we need going forward. So I think I'd like to see a bit more of a plan of how we're going to get that intelligence. I think not just of the backlogs and crisis, but the sort of work that we're going to be having to deal with maybe a couple of years down the line, which will ultimately then come into HQ&A, hopefully.
And that kind of horizon scanning, which may be across ALBs, I guess.
So we've got a plan, which is in our business plan, so we understand those differences, and certainly with the devices and digital agenda as well, we need to have capability there as well. So I think there's perhaps a bit more of a wider plan, maybe 2 or 3 years out. It's not going to be perfect, but at least giving us a direction, so we're not hit by a crisis. Because I think this is a crisis almost of our own making. We need to not have that going forward in the future and have much better planning and resilience.
Yeah, so we've got a few hands, but June and Mark, do you want to follow up on that? And then
we do have intel in-house from our innovation office, from our scientific advice meetings, from our innovation accelerator. We need to also be much more proactive in going out and getting it. And companies, I think, with pipeline meetings and so on, we should be operationalising that. So we create that plan. We're not sitting in a reactive mode. So I think there's a lot we can do here. I think the board previously asked to understand more what is done by the Innovation Accelerator. We've remodelled the agency on an end-to-end pathway. This has been a really important exercise in one step on that chain, but it's what's happening upstream that we don't actually pull together and have, when we do our annual report, looking ahead to see where we want to be in 1 year from now. So I really think that's a tremendously important action from this meeting, that we create. It's not too late for this year to start to look to see what's coming down the pipe.
Mark?
Can I absolutely support what June said? We're looking very closely at what meetings we get in terms of companies and academics coming to present what trials they want, and then building that into the intelligence we gather both through HQA's activities as well as SRI's. I'd also like to say that that has been raised as a significant requirement for the clinical trials within the UK, and so there are various measures in the assurance about gathering that information which we're contributing to. So we're hoping we'll have stronger external sources as well as our own efforts to actually get that information going forward.
On that, Claire?
Yeah, it's just to give more assurance around that joined up approach. So there are the three sort of areas of assessment that are front and centre of this, but digital and technology underpin all of that. So Mark and I and with other chief officers work really closely together, but we're looking at now, next and later. So what can we do immediately, and I mean this week, to help with whether it's more efficient processing, what we can do with existing technology and data to improve reporting, but then working alongside the delivery of RMS and with a view to O'Shaughnessy recommendations, so much broader, joining up in that way, and from a digital and technology perspective as well. So being proactive in all the different areas that we've talked about instead of just reacting in emergency mode.
Great. I'm wearing a couple of questions here. Raj, did you want to come in? I can't see a hand, but I think maybe you did. And I apologise if I didn't. I think we skipped you on the introduction.
No, that's okay. I'm Raj Long, a non-executive director. I had a comment on this topic, Graham. Can you hear me okay?
Crisply, yeah.
Okay, thank you. I think it's, out of a crisis, we have really thought outside the box and have created some really good solutions here. But I wonder if there's another opportunity here that perhaps should be explored by HR. If we are, if we are teaching our people new skills and getting them to be able to do different roles and be adaptive, is there an opportunity from a HR perspective to actually make that as a development opportunity as well, formalize it a little bit so people can express interest, and then you may have a ready pool that you can also draw on. And in the long term, it could be quite fulfilling for people because they come in for one job and they, when they move on, we don't want them to move on, but they actually feel they've actually got more than what they came in for. So I think there is an opportunity here from a HR perspective, or upskilling our organization that perhaps should be explored, Chair. Just a thought.
Thank you. Kerry, do you want to comment?
Yes, a really valuable point, Raj. Colleagues might know that the Government Skills Campus, which is part of Government People Group Cabinet Office, is doing a skills taxonomy across the whole civil service, and we're part of that. So it's understanding what skills we have as an organisation that are particular to us, but then what are the generic skills? So to know the capability of our workforce will be invaluable, but for the civil service to be able to react quickly to anything that it needs to know, because it knows where the talent is, and we can build on that. And there's quite a short time scale for that. So March 2024, I think there will be a big exercise. We're working on it now with them, but there'll be a big exercise. But I can see that there will be lots of really positive development things that can come out of that, where people can put their hand up and say, I've got skills in X, but actually I want to learn skills in Y. And yes, it's a very good point.
Thank you. Michael, Alison, you've been very patient. Michael.
Very little more to say, but I really just want to build on Mandy's point about forward planning. And I 100% agree with you. There are a number of key critical business activities that fall within the MHRA's remit. And I suspect what I want is a bit more assurance that all of those are underpinned by robust 3-year implementation plans that are escalated up into the business plan. And that's really important because you hear all the warm words, and I really agree with them about, the graduate scheme, great, apprenticeships, great, all of this thing about identifying capability. They'll all take time. And when will the graduate really make a difference to clinical trials? I don't think it's going to be immediate. So you need to have a critical path that the executive could look at and give assurance in each of those. And I don't know, to be truthful with you, I suppose it's an embarrassment. I don't know I'd like to ask the executive, what are the top 5 business critical activities that the agency, cannot in any way fail on? Because if they do, patients or industry are, and I'm not sure we've really discussed those in detail at board level going forward. So, sorry, elongating the conversation, but I really support what Mandy is saying.
Yeah. Did you want to come in? Anyone on that comment from Michael?
It's absolutely right, and I think actually our executive does have these perhaps not on the in front of mind, and I wouldn't rehearse them now. In actual fact, the piece of work we did showed 16 where value added is essential, but we've worked down, particularly through the Organisation Development Remuneration Committee, to the 4 signals, new drugs, established medicines, well, new technologies, let's say, healthcare products, and compliance. And we have to deliver on those every day, 24/7, every week of the year. Now, there are some other activities, and for any staff listening, I wouldn't want them to think that these don't count, and the 5th, of course, is clinical trials we've just talked about. But these basic services of the regulator, culminating in what gets to patients and what may be restricted or removed, is the core essence of regulation. Everything else builds excellence, the science that we have, the data that we have, all can build the value added that we deliver. But I'd like to assure that on every executive's hardwire, that is there.
I suppose my only challenge then is, are we confident, can't I ask this question again, are we confident that we got the governance right on all of those 5 or whatever activities? You know, and I don't know. It's a really open question. I probably should know.
I have a view as well.
Okay. Carly first.
I think that there is certainly more to do to get to the level of confidence that we want to see. And I think one of the critical activities there is the performance management data that we've been talking about in a number of different conversations this morning. That, I think, closes the loop in order for us to make these decisions, to move resource, to look ahead in a way that is better than what we're currently able to do. And that will make us more resilient as an organisation and more able to fulfil that primary rationale for our existence.
Thank you.
Did you want to add? No, okay.
No, that's correct. And I think the important thing is that we keep our governance under close review. A year ago, we identified a gap around, believe it or not, public health, because we saw that that pervaded and was the essence of every single of those services. But now we're at testing, if there's a question that comes up on access to cannabis or vaping or whatever else, that we actually have a governance that ensures these signals aren't, if you like, ignored or not picked up and run with quickly, because we're here to serve the public first and foremost. So I'm very pleased that the governance is regularly reviewed and tested.
Alison.
Yeah, the conversation's moved on a bit, but it was really back to the point about Raj was making. I wanted to point out that what we've done, sort of the silver lining, is we've effectively trained up a cadre of assessors who now can do clinical trials work, and there was a lag time, remember, in terms of training those assessors up. So one thing we're very cognizant of is the need to have a strategy about how you maintain that expertise. So that's an important point, and I think some assessors have very much welcomed the opportunity to expand their skill sets and enjoyed the work. But one of the other point was the principle of resilience is really also brought through with how in safety we've merged devices and medicines in common teams, and what we're finding there is very much that builds resilience. If one person leaves, there is another person with their skill set. But again, speaking to the lag point, we have had to do training. We had to have to put modules in place, and there is a time which takes to build up that resilience in teams. And through that process, we have identified gaps still, which require that more in-depth expertise, and we're going out to proactively recruit in those sort of selected areas. But I think that's just the principle of resilience is really critically important.
Raj, did you want to come back? I think you had a hand up again.
Thank you. I just want to bridge between what Michael said and June said. I totally agree with Michael about clarity around, what is the minimum we offer, on the table. I think we do it, but it's not clear. And I don't know if this is too far-fetched, but we talked about MVP in the context of technology, in the context of RMS. I wonder whether we should think of ourselves as to what is the minimum viable product the agency is. Think of it that way, and that might help us focus inwards a little bit to see, of all the things on the table, how do we come with, the core of what we do? Get clarity more on it. I think it's there, June, but I think Michael is right. It's just not very visible, particularly for the external aspects of the agency. So I just thought the MVP thinking is very good on the technology side. I wonder whether we can take the same kind of thinking and shape our own selves, in terms of the agency. What's the minimum viable product you have to offer as an agency? Just a thought there.
That's helpful. Yeah, I think that's something we can pick up. James, did you want to come in?
Thank you. The conversation's moved on slightly, but just to offer some reassurance to Michael that around those key services that June referenced, for example, my own other area is around compliance, is the compliance strategy has a very clear element of that plan addressing of future kind of resourcing and pipeline. So that is not only the training we do internally and externally, but how we develop the pipeline using some of those tools we referenced, but also how we change the recruitment offer. Very much a lot of the areas we work in is quite a bespoke area of business and quite niche, so we need to very much target our approaches. The one-size-fits-all approach isn't appropriate for many of the areas we recruit into. So I think what you'll see is most of those areas will have fairly local plans, very relevant to their own speciality, but that sits under that overarching plan for whether it's per group or across the agency. So certainly for compliance strategy, when we presented that, you would have seen our thinking for that element.
Great. There's one thing that I just wanted to pick up on in the paper about the pilot. So we haven't really discussed that in detail at the board, but can you just talk us a little bit more about how that's going to work? And I think, from a public perspective, obviously they want to be reassured that this isn't going to compromise safety and decision making. So what monitoring will be in place and what decisions will be made on that pilot?
So the proposed pilot is one that very much has patient safety at its heart and risk proportionality. And by that, I mean it addresses low-risk trials. So clearly if something is, there's a high degree of uncertainty, is perhaps a better phrase. For example, a first-in-human trial, that wouldn't be eligible for this approach. There are a set of criteria related to equivalency to existing standard of care or the use of an existing medication within its licensed indications, for example. So there's a series of criteria we work through to determine eligibility. We've taken advice from our own experts on the Commission on Human Medicines and also engaged with some of our external reference groups, for example, the trades associations. So we've taken feedback on that. It is very much a pilot, so there'll be very careful and close monitoring by the team involved in that as we go through the pilot. And certainly we'll be looking to, if there are early conclusions we can take from that, refine and modify the pilot. That's something that then provides the evidence base to inform the legislative proposals aligned with the government's response on future clinical trials regulation. So certainly there are clear criteria. We have sought expert advice on it, focused on patient safety and risk proportionality, and something that we'll be using to provide an evidence base for the future regulations.
Great. Paul? Just a twitch. Okay. Yeah.
I think it would just be how we report on that, and that governance process around how that progresses would be useful to have at board. So whether it's as part of the performance, so we understand when it would go in, would or would not go into legislation, what the decision points are. I think that would be really useful to monitor that pilot.
And I think you said it was a 4-month pilot, but I don't know if there's an opportunity to feedback what would be an appropriate time, maybe in 2 months or something.
We'd be more than happy to do a kind of a snapshot perhaps midway through to see how things are progressing. I think one thing we're conscious of is we've set criteria working with our experts, but if there are opportunities to revisit those criteria as we learn through this, whilst always having a very careful monitoring process, then I think that's something we're open to. So bringing back that update to this group, I think is something we welcome.
Great. November. So November would seem like a reasonable time. I think we haven't really talked in a lot of detail about the staff who were redeployed and when they'll be going back. I think one of the things that obviously is concerned internally and externally is the indirect effects of redeployment. So can we just comment on where we are with getting people back to what they were, where they would be normally?
So if I come in initially. So we're very carefully modelling the resources required to maintain performance as we bring in additional resource as well with the recruitment exercise, and then doing a phased return of redeployed staff, very much aligned with the strategic priorities set out in the paper under that section, but also to address any mitigated impacts that have occurred during the last 7 to 8 weeks redeployment. Some staff have gone back. We're certainly working to get them back as soon as possible, but we're making sure that we're managing very carefully the impact on clinical trials performance as they go back. So it's a phased approach linked to the risks and strategically aligned in terms of where it's then going back to support things such as the life sciences vision and some of the other priorities the agency's established.
And it looks like there's been some areas that have been protected from that redeployment, which are aligned to those priorities as far as I read it.
Yeah, absolutely. So we did not redeploy all of the staff into clinical trials. It was a proportion of the staff to enable there to be that ring-fence protection of those priorities, but also as we phase back, making sure we prioritise the return of staff for other relevant areas, and that's in coordination with the relevant chief officers for HQA, SNS and SRI.
Great. Okay, thank you. Any other comments? Penny, any last sort of comments in terms of lessons learned that we haven't covered?
No, I'm comfortable with what we discussed. This is obviously an ongoing process, and we'll continue to build these out as we get them, and we're looking to get a clear action plan so we can absolutely move these forward. Thank you.
Okay. Well, June.
I think that the big take home, and we've learned an enormous amount, and thank you to James and to Penny, we have to do things differently. The thorough, rigorous review of every single application or amendment is a disproportionate use of resource, scientific and technical, and that's why the pilot is the critical step. Looking particularly at other jurisdictions like Australia, Singapore and others, for whatever reason, there's been a creep of resource. Those that remember the clinical trial exemption scheme, the doctors and dentists exemption, know that this worked perfectly safely, and therefore what the board will look for in November, yes, is assurance on safety, but the fact that we need to be very clear about where we devote our resources to the kinds of high risk or uncertainty areas where rapid assessment is going to add value.
Yeah.
So I think that is the big message for us all today. It's perhaps for many reasons a bit of a late comer to transformation, but this needs a transformed approach so that we can truly have a proper end-to-end pathway for the agency.
Yeah. Okay. No, that's helpful. And I think, being mindful of the opportunity costs of doing things when we could be adding value with the same resource. So thank you, James, Penny, for coming. You're welcome to stay, or you're welcome to go as you desire. I think clearly this has been a difficult period, and not just for the agency, but also for people trying to do trials and for the people who are going to benefit from the trials and the patients at the end of that. But I think, again, to acknowledge the work of the staff that's been done in the last couple of months to address this, I think is really important. And thank you again on behalf of the board to everybody both here and outside the room who've committed so much time to that. And I think hopefully we can see this as a positive step forward in terms of how we prevent problems and we can tackle things earlier. I think we've heard some of the positive things that we need to do more about, and I think there's clearly is still work to do in terms of defining the better targets, not just on trials, but on some of these other critical areas, whether it's a minimum viable product or not. I mean, some of these areas that we really value highly, and making sure we get that data in a regular way, in a transparent way that we can act on quickly, I think is critical. And finding those, I think we need to address that again as a board probably relatively soon to make sure we've got that in progress. We've heard about scoping, the horizon scanning, upstream work, and hopefully that will be more clear in its importance after this, and there clearly is some work there, but we need to see the benefits of that coming through. And then we've heard potentially about some of the issues for the workforce and skilling that workforce that may be benefiting both in the short term, but in how we think about the workforce and skill them in a way that's appropriate. So thank you for that, and we'll go to the next item, I think. And thank you both. And I think someone's coming in for the next item, is that right? Yeah. So we'll just wait a moment while we get through the report. Welcome. So our next item is on the work that's been done in the organisation to deliver an excellent culture. And I'm delighted to welcome Malgosia to the committee. Could you briefly introduce yourself, and then perhaps if we could get the introduction to the paper, that would be great. You just need to use a microphone. If you press the button, sorry, we didn't give you the briefing, but yeah, if you just press the button in front of you, you might want to bring it towards you a bit.
Okay, sorry about that.
Good morning, everyone. My name is Magosha Malak, and I'm the Head of Organisational Development, Talent and Capabilities. And the paper I've put forward to the board is about how the board can influence an excellent culture with strong leadership. And there's also a presentation attached as well. I'm not going to spend time going through the paper, but I just want to sort of make some key points and some key observations around culture, around leadership. I've been in the civil service for over 30 years now. And I can honestly say with a hand on my heart that this agency is the first place I've worked in all of that time where culture has got really, really strong prominence and is seen as a priority and recognised to be influencing performance and well-being. And there's lots of evidence of the things we are doing on the surface to actually pay attention to culture. We have a strategic risk around it. We have it referenced in our corporate plan, in our business plan, in our people strategy, and we have values and a behaviours framework which is underpinning the culture. But culture itself is actually something really quite intangible. It's not a static object, something you can hold or a problem to fix. And I quite often like to use the example of, you take your car for a service and they plug it into a computer, they see what's working, what's not working, and they can fix whatever's not working. But culture can't be diagnosed in this way at all. And to actually diagnose culture and what's going on, we need to look below the surface. So I'm going to use another analogy, and that's of a lily pond. And if you think about a lily pond, I was in Wisley at the weekend, and there were some beautiful lilies growing on the pond out there. And actually what struck me is for those lilies to grow and to look so beautiful, the pH conditions of that water have to be just right. So my question is, what are we doing in the agency to enable those healthy conditions to get that pH balance just right for our people to thrive, for those lilies to grow? So we do have some tools available to us at the corporate level which have been referenced, and they are our culture action plan. We use culture, pulse, people surveys, and the civil service people survey has actually gone live this morning, so that will be a next lot of data we're going to be able to get in. We have in our culture and ways of working group, which meets bi-monthly and does a regular temperature check on what's going on around the agency. We also do check-ins with new starters at corporate inductions to find out their experience of what's going on in the agency. And all of this data is being reviewed and fed in. And we also, even through the sort of all staff meetings, the opportunity for question and answer sessions is also another opportunity to test out how people are feeling and what's going on culture as well. But actually, it's leaders who have the biggest impact, and their role isn't just getting the task done, the performance done. It's also focusing on how that is done. And it's really, really important for leaders to make time for those softer skills development to get their teams engaged, motivated, feeling empowered and developed. So what are we doing in the agency to sort of help leadership with all of that? Well, we've invested really quite heavily in leadership development. We have a leadership development plan. You will see from the paper the great work we've already done to sort of build up leaders' capabilities. We're not focusing on defining good leadership in terms of what good leadership is. Instead, our focus is on the behaviours and actually getting leaders. We have leadership in action attributes, which lists 8 behaviours for all leaders to follow. And if leaders all follow those behaviours, not all of them at all times, but most of them at most times, then I think we'd actually be able to crack it. None of this is really rocket. It's not rocket science. We've established one agency leadership group, which is now established and also concerned with questions around leadership and culture. But I think ultimately, just to sort of finish off, to create an excellent culture with strong leadership, it's about you as leaders taking responsibility. And on the last slide, it's about enabling those conditions, seeing through the leadership standard, setting the leadership standard, sort of consistently role modelling the right behaviours, engaging staff, assessing leadership capability, prioritising leadership development, and ensuring that culture, people considerations are taken account of in discussions at board meetings and other senior meetings. Thank you.
Right, thank you very much. And I think you can assume everybody's read the paper, so questions on this? Paul?
You know, it's very encouraging, although some of it a bit worrying, comparing other bits of civil service when we look at the overall staff survey results across MHRA and other areas of government. It's sort of a reflection, really, or asking for a reflection. If we look back behind over the last couple of years and the difficulties we've had with both culture and the transformation, what are the underlying reasons which you can identify why we had the difficulties? And then why we've made, I think, as we had in the last session with clinical trials, then we do make some really quite rapid progress. So what is the compare there?
I mean, that's a really, really good question. But also, you know, the agency is in a different place now to where it was a few years ago. A lot has happened, and that actually influences people's perceptions. But I think also maybe how the transformation maybe happened, and a lot of the hearsay around the transformation is people felt done to rather than being done with. And I think maybe if change can be done with people, involving people, then it's actually more likely to stick and to sort of be done in the right way and be impacted in the right way. And there's also things about nobody likes change. Change is a really, really hard thing because it's seen as a threat. Even something as simple as, you know, not sitting, you know, sitting somewhere else can actually be perceived quite negatively by people. So I think it's human nature to sort of push against change, and I think some of that has also happened.
And do you think that's now been addressed and has changed?
I think there's a recognition that I think it's a work in progress. I think we are doing more with people. We're getting people more involved in conversations at local level. We're paying more attention to what's going on at local level. The approach we took to reviewing the values was conversations at local level, supported then for the behaviours framework by what behaviours can people commit to practice within their own teams, which are relevant to them to doing all of this. So I think by actually investing time in these discussions, even though it seems like a big ask given everything that's going on, will reap the benefits longer term.
Can I ask about, I don't know, do we have figures on the different uptake of staff surveys across different ALBs? Have you found that in your digging pool? I mean, the uptake is relatively low, I think, and it'd be helpful to understand how we can help to improve that, given the importance of it, and whether we're an outlier in that.
I think our uptake actually, I wouldn't describe our uptake as particularly low. I think our uptake is quite good compared to some departments. I don't think we're the top. I don't think we have like over 90%, but we do have. I think our rates for people filling out surveys are reasonable. They are definitely, and I think the data we get is definitely representative of how people feel because, yeah.
Okay. Mandy and then Hader. Oh, sorry, you were twitching. I thought you had a Hader, sorry.
So just picking up on that, is that the engagement score, 62%? Is that the percentage of people who fill out?
No.
Sorry, Hader, you just need a microphone.
Thank you. Do you want me to repeat that?
Yes, please.
No. The engagement score is based on how people have filled out the survey. So the engagement score is worked out on the basis of 5 questions, which measure whether people want to stay working for the organisation, whether people do their best when they are working for the organisation, and strive, and what people say to others about the organisation. So the amalgamation of people's responses to those 5 questions gives you your engagement score. And the Pulse survey we did back in June gave us an engagement score of 62%, which was higher than the engagement score we had in the People survey last year. It'll be interesting to see. I mean, I'm hopeful we'll be able to at least maintain the 62% when through the People survey that's done now, but we won't know that until about December time.
Okay, I mean, that's very encouraging that it's going up. Have you got a feel for how many people actually fill out the survey? And you say it's higher than most other ALBs?
Off the top of my head, I don't know how many people did. I think some 532 people filled out the Culture Pulse survey that we just ran, but the actual people survey, I think we will probably be aiming for about 65% to 70% of people to complete it this year.
And those are the two surveys that give us most of the data around culture?
Yes.
Okay. Do we do exit interviews as well?
Yes, we do exit interviews.
Have there been any themes that have come out of that?
I'll pass that one over to Kerry.
So just put the mic on, Kerry.
Doesn't want to go on.
Maybe Paul will step in.
Thank you, Paul. Yes, we do. They're mandatory for SCS colleagues, and for delegated grades, they are optional. However, we're developing a Microsoft form to be able to take data from exit interviews, so early warning signs, etc. So yes, that's a piece of work we're doing as we speak. Yeah.
And can I just check, so you put some helpful figures from the Pulse survey in there, but it was a small selection, and does that go to ODRC, or where does the visibility of that sort of fuller data set go, Mandy?
Yeah, we had quite a comprehensive discussion of this at ODRC, which I wasn't. I can either take now or is in the assurance report. So we did discuss this at length.
Okay, well, maybe we'll come back to that. That'd be great. I mean, so just looking for questions. I mean, I noticed in your paper you're offering to teams a support to facilitate, and I was interested to hear from the execs as to who's taken that up and what their experience of that was. Has anyone taken up your offer yet?
We've had. Yes, we've sort of talked to HQ Healthcare Quality and Access about it. We've talked to Safety and Surveillance about it, and we've got plans with Science SRI about it as well to progress.
So it's in progress.
So it is in progress. Yes, we're planning to do this work this quarter.
Great.
Yeah, so we were talking about this before the board. Excuse me, and I think this was not the one that's referenced on slide 8, but the one that you had run previously, Malgosia, with all teams, and reflecting on how useful it was to get the teams together and explore what they were feeling had improved and what still needed to improve. I think my takeaway was the ability to then go and tackle all of those things that we still needed to improve, and how much control you have within individual teams, and how much of those are kind of recurring themes across the organisation, which is kind of to your point really, that culture is that amorphous, intangible beast, and trying to drive that change individually is quite challenging.
I mean, ultimately, I think we all, whether we're leaders have more responsibility, but I think everybody who works in the agency has a responsibility for shaping the culture and for behaving in the right way, which is why we can put all the tools in place, we can put the plans in place, but ultimately people are encouraged to actually behave in a way, and we need permanent behaviour change in order to change things for the better. If we carry on doing the same things in exactly the same way, nothing is ever going to change. So the trick is to actually put in some sort of a disruptor, make some sort of intervention, something to change and challenge that status quo. So, there's a lot of, even I think with the clinical trials work, there's a lot of learning that's come out from that, and a lot of positives that are coming out from that as well. So that's sort of been the catalyst and the change. So it's how can we then, sort of with the things that have changed, how can we sort of build on the positives from that to make sure that they become the new permanent, and that we don't go back to how things were before. So that's sort of the challenges we face. So once we've changed that skill, once we've changed that behaviour, it's what do we need to do to make sure we then continue with the progress that we're sort of making and the progress we're starting to see, and how do we stop people reverting back to what's comfortable for them.
Yeah, and I think you've got some specific asks to board, which we've seen, and I think it would be useful to hear from maybe some of the execs as to whether there are things that are being done differently around that. I think, did you want to come in, Julian?
Yeah, so really looking at it from an HQ&A perspective, we have been looking at this as quite some things. What do staff feel? How do we have open discussions? So for me, very much culture it's an evolving thing, but it's up to everybody to then go out and live the culture that you want to be. So it's really seeing how we can use the tool that Margosha has been mentioning, but equally that we focus in the different areas of the group to say, right, what are we doing? What are the clear action plans that we have? But equally, it's linking it back to the topic that we had earlier around staff development, training, looking at that aspect, because that all forms the culture that we have. When we redeploy staff, that has a knock-on consequence as well to the culture. So it's understanding that it is a dynamic thing that we are actively doing and listening. So for me personally, I mean, I'm doing a workshop on Friday with some parts of HQ&A, and really part of that, quite a long part of that, will be about listening, will be about having an open discussion. We'll be setting people off to go and have a long, conversations, just so that we can bring those things out and flesh them out. So it's an active thing in progress, and I think as we go through the clear asks and the understanding of this, it's really looking to try to make sure that we have the priority given to this, along with the training, along with the deliverables, that we come up with this MVP part, which I quite like that term, but in terms of seeing how we can then deliver that as what our core deliverables are. So it's that kind of, all of that, it all shapes it together.
Yeah, great, thank you. Claire, did you?
Probably 2 points from me, and on the topic of change. So something that you mentioned earlier, I don't know if it's an assumption around people don't often like change and so on, and I can understand that in the context of transformation, perhaps, if people have felt it's being done to them. And there are definitely subcultures within an organisation. So for example, the reason I asked that question was because I have the sort of opposite issues in my area in digital and technology, where people are champing at the bit for change, but and not necessarily in big ways such as clinical trials, and that's reacting to something bad that's happened. It's in the smaller ways that are baked into our ways of working, and that is what ultimately makes our organisation, or would make our organisation, more agile and flexible and so on. But I think there's something about people being empowered, even in small ways, to make changes. We seem quite, dare I say, risk averse sometimes, a little bit bordering on traditional. So I have to, when I talk with my group about it, just talk about our circle of control, because we can't necessarily go and change everything in the agency that we think, even in small ways, would make a difference. So that does chip away, I think, at a culture, and it has a positive or negative impact depending on how empowered people are. But it's something that comes up in my area all the time.
All right, thanks, Claire. There's a few hands going. So Alison, Glenn and Paul, I think.
Hi, yeah, I just was reflecting. I mean, it's quite a complex dynamic at the moment, because we've got obviously older staff who have been here for a long time and perhaps are managing different feelings and perspectives, and then we've got newer staff coming in who are also coming in with different feelings and perspectives, and they have different needs, and we're managing all that in a hybrid environment, and that's obviously quite challenging when new members of staff join, and making sure that they feel they are part of a team rather than just on a sort of a team's call. So, certainly we're trying hard to make sure people do feel supported, that there's times for them to come in and have that touch point, very much around rewarding really excellent work and in a timely fashion, so that's acknowledged. Accessibility, I'm trying to meet all new members of staff, just so that they feel that they know people. And then what we're doing, we do run Q&A sessions on all of our safety and surveillance staff, sessions, so that people can ask the questions that are worrying them and that they get an answer at that point. But I think it's all about active listening, but also making sure that people feel consulted when there are issues coming up, and that there does need to be change. Even with the clinical trials consultation, when staff needed to be redeployed, we made sure we talked to them about it.
Okay, Glenn.
I guess just to add another local perspective, really, how do we take pulse survey? We're pretty open about that in my group. We're trying to, the culture we want in partnerships is professional, respectful, collaborative, all the things that you'd want in an organisation on a grander scale. We work individually in teams. What are the things you'd like to see that improve your day-to-day life and the culture of the group, and by extension the agency? We have formal routes to train our leaders. Some are on formal programmes. I think an example today, even in these papers, about the devolved administration engagement was offered as a development opportunity for staff in the teams who wants to engage on this quite important area of policy. So it's a mixture of things, making sure there are individual work-life environment factors you cater for, team-wide, group-wide, and then also picking ways to train people formally so they get that kind of build and that development opportunity, including an opportunity to put someone who is a coach onto formal training about kindness and well-being in the workplace. So trying to do all those things to address, there are a lot in the Pulse survey, you're right, I had to pick it up, there's quite a deep document, but you can quickly translate that to local action and to make sure that your teams are in the best place they can be.
Great. Paul?
I mean, it's on the empowering staff question. Is it that staff are empowered, and to what extent are they empowered, but they I don't realise it and they need to be encouraged, or are there particular things that need to change to increase the amount of empowerment? And if it's on the encouragement, do we pick out, and it was maybe particularly for Kerry, the Ds, like in the DISC sort of analysis system, and there are other ones for psychometrics, but those sort of people who have got the particular personality type that if you're doing a big change can lead the change and then model the behaviour?
Absolutely, yes, and but it's all about that localness, isn't it? And as colleagues have touched on, behaviours at a local level and knowing your workforce and knowing what it takes to bring them along. I can speak for HR in that HR people tend to people focused clearly, but we're also about customer service, and so our behaviours, for instance, were about delivering great service because that feels great when you do that. So we get something back from that. So understanding who our people are, if I've got your question, to be able to then bring them along in any change that we're proposing to do, we have to understand what those people need to be able to do that successfully. And it was a good point that Alison raised. We have a lot of new starters who need a different thing. We also have a lot of people who've been here many, many years who need something different. And so it's understanding that whole cohort and why it's different and why we need to personalise everything that we do, which is why I'm really pleased our values and behaviours framework is much more local and personalised. I don't know if that answers your question.
I've let it run on a bit because I think it's important, but I don't know if there's any last comments. I think I'll give you the last word, because I mean, I think that you've given a clear list of things for the board, which I hope everybody will embrace. And I suppose my question to you is, how are you going to tell us if we're not doing well enough?
I think the survey results will tell all of us if we're not doing well enough, and I think it's a shared responsibility. It's not. It's. I think we have to acknowledge it's a. I think the first thing we do have to acknowledge it's a shared responsibility, and we all. It's never. This is never going to be something that we can put a tick in the box and say, that's it, done. We can move on to something else. This is something we're going to have to work with all of the time. Even if we get like fantastic results, that doesn't mean to say we can think, oh yeah, that's it, it's sorted, because it's not. It's something we have to be sensitive to and be working with all of the time in order to, once there is, having made progress, to maintain that progress and to keep on building that progress as well. But also being kind to ourselves about it, and there's only so much we can do at any one time, and I think we have to be kind and acknowledge that as long as we're doing our best, and as long as we're sort of the behaviours, trying to sort of live those behaviours, the leadership behaviours, the values and the behaviours that we've set out locally for ourselves and for our teams, I think that's a good recipe to to get that pH balance right in that lily pond. For those lilies to thrive.
I can picture them now. Thank you for that, and thank you for coming. And I guess you might want to leave, in which case that's fine.
Graham, I know the agenda, but would it make more sense to do the ODRC?
Welcome to, if Raj doesn't mind. Yeah, so if you want to move to the ODRC, then we'll come back to the PSEC paper.
Just thinking.
It does segue. You may want to stay for that if it's. Thank you, Mandy. Yeah, so over to you.
Okay.
Mark.
So I think this, Malgosha was also came to ODRC, and we had quite a lot of ODRC activity in July. So we had one meeting where we were looking primarily at remuneration, which is sort of a formal part of our role. I met with the One Agency Leadership Group, and we did a workshop session. And again, part of that, trying to practice what you preach and walk the talk. So I think, again, that was very valuable. And again, we have immensely talented staff throughout the organisation, and that was a hybrid meeting. And then we worked on things, and Malgosha also gave a feedback on the surveys, which I think there was a little bit more in-depth discussion around that. And that's one marker in terms of that. But I think what was encouraging, although the stars aren't all aligning to we've done this, is there are some green shoots, I think. So the pH is getting to the right place in the lily pond, but I think it's very fragile, I think, at the moment. So I think that's very encouraging, and we've looked at the whole the amount of change, but I think we can also take the changes that are happening in the organisation. So we've had a couple of crises. Now we're probably more comfortable in a crisis because clear objective, you just got to get on and do it. But I think the discussion we've had on clinical trials would be really important to embed that changes. June said earlier about we have to change the way we do things, and that's probably now very obvious to the organisation. And then the processes and frameworks which HR deliver, I think are really professional. You're not going to get them any better. So the civil service frameworks, the work Malgosha's done on the culture and leadership development, and Kerry and the team, are the best you'll get anywhere. So we have those tools to use, and it's about now making sure there's enough time and priority, as I think Alison said, to take that through the organisation. What we do is how the board operates is one important part, but so is EXCO, so are all of the other teams that we work through. And so I think it's there. There's only so much you can do in process and framework, and I think the board should be assured it's very professional in that way. I think then the taking that through of how that works through the organisation, and taking every opportunity, whether it's through a new working process in how HQ&A are working, or how we're changing the customer experience centre, and all of those things. We have the tools. I think the only thing I perhaps need a little bit more assurance on is that the corporate plan objectives are cascading through the organisation into people's personal objectives. And I think that's one thing we need a little bit more assurance on, that that's happening.
And that goes back to some of those survey comments about leadership and
maybe
direction.
some feedback that that's happening in teams, because that's our golden thread.
Yeah.
So we have the tools there. I'd like a little bit more assurance that those messages are getting through. So I think the same professional leading by example, you see really good examples of that. I think there's and we've talked about listening by some of the teams. I think that's really important, to listen and connecting. And I think I was really encouraged again to see connection between what HQ&A are doing in clinical trials. We now need to work that through and build on that. That was the things we couldn't do during transformation for whatever reason, but now we do have to do that. So I think there's all of the right frameworks and processes are in place. We now have to take every opportunity as a learning opportunity, but I think there's also about a few things that we could do better, particularly around performance management and target setting for individuals, so they feel connected to the organisation, and that everybody's contribution, they see where they add value, because they do.
I think that's helpful. Comments? June?
I'd like to use the chance to thank Mandy for the One Agency Leadership Group session that you ran, which was really helpful. I think you've summarised it there, but it got people very much to appreciate how fortunate we are to have this common, all of us have the common public health commitment. As an organisation, that really is, if you like, the big golden thread. I think you've seen with the clinical trials initiative how when there is a really clear common purpose that everything works. Yeah. And then the question for leaders now is how to make sure that we're communicating that common purpose in the day-to-day. I'm not saying make exceptional the everyday, because every day has to have a work-life balance and time for team building and so forth. But I think ultimately this is the core element now, to build from the clinical trials experience so that that common purpose is really clear and, as you say, hardwired into the objectives, targets, etc. on an individual level. So that's, if you like, the challenge. I think we've got another one agency leadership group in a week or thereabouts to keep that flowing. And maybe when it comes to our values, as Alison said, that we do much more as leaders to show how much we value performance, outcomes, the delivery of what we've done. So a lot of work we talk about for the future and new things and how we'll, conceptualize them, but actually it's what we do that matters.
Hader?
Thanks, Graham. And I just wanted to pick up on one thing Mandy said. She used the word listening. And when I was asking, going probably a bit too deep on the pulse surveys and things like that, that's exactly what I had in mind. In my experience, people who fill out surveys are generally the same people in the organisation. There's people who fill out surveys and there's people who don't fill out surveys. I'm probably one of the people who don't fill out surveys, so I know what it's like. You spend your time on what you think is important, and if they're feeling a bit disgruntled, then chances are they probably won't be filling out that survey. So I think it's really important to listen and to address people's concerns, and that's really how you start turning that cultural wheel and bringing everyone on board. Otherwise, they're still in that group, potentially being, a bit more disgruntled, and that flows out into everyone else. So I think the one thing I'd say is, I love everything we're doing, and I think we're really heading in the right direction, and I truly see the green shoots coming as well. If there's anything we could do to increase our coverage of how we listen, whether that's a different medium or another tool, and I found a good one online that I'll just send you for your interest. But I think that'd be really, really great if we could listen to everyone and act on that.
Okay. Any other comments on the paper as it is? See. Oh, sorry.
I mean, I just wanted to sort of respond to Heidi's point about listening, because I think the listening is also a request coming bottom up. When the One Agency Leadership Group was first set up, we did a sort of quick survey from various representative groups in the organisation in terms of what it was that they wanted from that One Agency Leadership Group. So it was just like words which were put into a word cloud, and the top word was listen. So that was the request, top up from the organisation. So if the will is now to listen, and that's the request, I think that's going to be, that's really quite encouraging to be able to do that.
And creating more opportunities for that listening, definitely. Claire?
One very quick comment. I wonder if when we talk about listening, we mean listening and acting upon, because I've been here a while now, a year or two, and I see themes all the time recur. So we're listening, but how much are we acting upon it for those themes to remain? And that's not a question for you, obviously, Margosha, but I think that's probably what our colleagues mean, listen and then taking action.
Going beyond that. Mm-hmm. Thank you. I think we'd better, in the interest of time, move on, but thank you, Mandy, and thank you. So I think Mercy was going to present the PSEC paper, but Raj has kindly agreed to do that. So Raj, if you can hear us, are you happy just to take that?
Yeah, can you hear me okay? Yeah?
I can.
Thank you. Apologies if I start coughing in mid-sentence, but try and avoid it. So I'm presenting the PSEC paper, which is the Patient Safety and Engagement Committee paper on behalf of Mercy. and a lot of the discussions was really came out of the 11th meeting we had, PSEC 11th meeting in 9th of August. There are some really, essentially there are 3 topics in the paper, 2 on products, fluoroquinolones, as well as the rectopexy mesh. Both of these products, the ask was very much, are we engaging patients sufficiently? Is the engagement of patients adequate, sufficient in the context of some of the safety issues that's been seen? And the third item on the paper is around the yellow card biobank consent process. A couple of key call-outs on the first 2 products in the fluoroquinolone discussion. There has been a lot of discussion, just for context, there were a lot of concerns raised over a period of time, particularly around to minimize particularly around connecting manufacturers and between healthcare providers, communication between healthcare providers and patients as well, on this as well as on the other product. So the details are all in there, but the key takeaways from this is to really say a range of measures were taken to the committee, and we've been assured that the appropriate measures have been taken. Some outcomes from those measures were that patients, there was a lot of outreach to patients who had AEs as well as their carers, and the committee also pointed in the direction of looking at data on benefit in the context of fluoroquinolones as well. A new area that's emerged was psychological side effects. This was raised to CHM and is on their radar. And last but not least, on this topic, the committee actually said, to maybe explore to see if there's a genomic basis for working out who suffered the AEs reactions together with the, sorry, excuse me, in the context of the AEs and the genomics. Is there a linkage there? And to use the yellow card biobank if there's any insight there that we can leverage. On the rectopexy, again, just to highlight there to say, the review basis was really based on the Independent Medicines and Medical Devices Safety Review. So PSEC just assured in the discussions that the testimonies from this review were brought into the discussions of the PSEC review. And I think one key component that came out of that is to request that MHRA, the agency, takes a proactive approach in terms of to manufacturers, largely, in terms of ensuring adherence to guidance and ensuring that the label is adequately outlined. So those were the 2 key areas came out. And then the other last component on this was that the committee also suggested consider supporting the development of a register for these patients so that we can monitor it. It was just a suggestion for discussions. On the yellow card biobank consent process, that was really just around, what is the consent process? The key outcome there was generally a direction being pointed towards Genomics England to learn more from their experience and bring it back to the yellow biobank. We did look at minors, how can we get consent, but it became too complicated because of the legal complications implied there. So all in all, the committee made recommendations in each of the papers and was assured that the officers were heading in the right direction. The quality of papers was commended on by the committee as it was allowed for good, productive discussions. I'll pause there, Chair, and Alison is also there.
Thank you, Raj. It's very stoical. I hope you've got some water there for you. Alison, do you want to comment?
Not really. I think that was a really good overview. I just pick up on the point around suicidality and the fluoroquinolones. Certainly the publication of the recent DHSC suicide strategy gives us another tool and an approach to maybe explore that particular obviously very tragic ADR that can arise or associated with some medicines in a more broader context, and we'll look and see how we can maybe leverage that strategy.
So help me understand how that might help. I don't know much about that strategy.
Well, the strategy was just recently announced. It's got a number of themes to it, but one of the themes was what were the underlying causes of suicides, and I guess what's not being considered hugely in that is the contribution of medications to some of those underlying suicide themes. And so we'll look back over years and of trends to see is there any theme that we can extract there around how medicines might be contributing to a suicide at all in the work. So that would be one thing. We're also looking at routes of suicide, so that's another separate theme and not really considered within these particular papers.
Great, thank you. Thank you, Raj. It was a very comprehensive summary. Any questions or comments on the paper? Otherwise, thank you, and we note the assurance. And I think that concludes our papers. We've got questions, I think, from the public. Let me just check my notes. So I think for those still online, I think as we've discussed before, this is a board meeting in public, and that we will take questions related to today's agenda. I think we did get some pre-submitted questions, and I think we may have one person who has agreed to come on camera. I don't know if they're still there. Is it Andrew Wiles? Are we able to bring Andrew on camera? Andrew had a question pre-submitted in relation to the clinical trials backlogs, which may or may not have been addressed. So, Andrew.
Hi.
Hi, Andrew. Can you hear us?
I can, yes. So thank you for the opportunity. My name's Andrew Wiles. I work for Ono Pharmaceutical Company Limited. My question was essentially addressed because it was around the MHRA progress and addressing the backlog of CTA and new and substantial amendments. So that has been addressed, and thank you for that, the board. I just had a sort of follow-up question to that. In relation to the discussion on the CTA experience, a plan was actually outlined, and there were a number of individual contributions given. And as one of the board members said, there was a lot of warm words around that. I just wanted to know, in terms of the communication of the progress of that plan as it moves forward, what are the plans and who is taking overall responsibility? Because there are a lot of individual elements discussed. So who's pulling that all together, and how will that be communicated externally?
I'll come to Mark and Rachel in a moment. So we don't have the officers who were here in the room earlier, unfortunately, but maybe Mark, do you want to comment, and then perhaps Rachel?
Yes, Andrew, thank you very much for the question. And yes, the communication is something that has been coming out very, very strongly throughout this, and many requests for clear, transparent communication. On clinical trials, that will be run with the clinical trials team providing technical and our communications teams running outreach. We have at the moment a industry academia group which we are busy developing further to get to greater outreach. We're also accompanying that with a series of presentations on meetings and looking into what goes onto the website. Now, what we'll be looking for is feedback from people like yourself in order to make sure we're reaching, because we had been doing some communication before, and it became very clear in addressing the backlog that it wasn't up to standard that was required. So yes, we will have the monthly data we're launching, but we want to build on that. So you should be hearing more from us from various forums going out, and I would very much encourage you to contribute to the new group as it develops, and we just make sure that we're getting there. So any feedback, just through the customer experience line, if you're not hearing from us, do reach out and keep asking the questions so we can make sure we are communicating.
Thank you. Rachel, do you want?
Yeah, thank you. Just to build on Mark's comments, the plan we're taking forward is really at three levels. One is direct communication with companies that have applications in with us, so that they are kept more regularly and more proactively informed of the progress with their application. The second level is working with key stakeholders, including trade associations, different groups, as Mark said, programme of events and conferences and so on, so we can actually get to wider audiences, and then underpinning that with a broader communications programme, case studies, regular publication of data and so on. So it's really operating at those three levels.
Thank you. Andrew, do you want to come back at all? Does that answer your question?
It does for now. I just look forward to hearing the future plans, and maybe there could be an update presented at the board meeting on those progresses and what feedback you've had.
Yeah, I'm sure there will be. Yeah, thank you. Okay, Rachel, do we have other questions that have come?
We don't have any other questions this morning on topics that have been on the board's agenda.
Okay, thank you. Anything else we haven't covered that people would like to raise? Oh, we can see ourselves. That's a frightening prospect. Great. Well, look, thank you for everyone for a very nutritious discussion.